Hi, I'm Dr. Timothy Murray, coming to you from Miami, Florida. It's my pleasure today to speak with my colleague and friend, Dr. Prithvi Mruthyunjaya. This focus today is to give you a brief overview of uveal melanoma and what it means for you as a patient or for you as a family member. Prithvi, can you tell me a little bit about what is uveal melanoma?
Uveal melanoma is the most common form of eye cancer in adults. It is a growth that usually occurs within the eyeball itself and can grow over time. And unlike other types of growths, this can actually be dangerous because it has the potential in some cases to spread outside the eye to other parts of the body. The word melanoma you may hear of when you think of skin melanoma and spending time in the sun. The difference here is that this type of melanoma is not related to skin melanoma, but it only occurs and starts in the eye itself.
So Prithvi, who's at risk to get eye melanoma?
Eye melanoma is a bit of a mystery in many ways. There are no specific risk factors that we are aware of that someone has or has done, except we do notice this more in folks that have lighter skin, so often in Caucasians, Europeans. Often it occurs in middle-aged to older individuals, so very rare in children. And sometimes we feel that there could be a risk of things like sun exposure or UV light maybe playing a role, but it still remains a bit of a mystery as to who may get it and who may not.
So does this run in families? If I have it, are my children at risk, or my brothers and sisters, or my parents?
That's a really good question and an important one. In general, no. There are very rare genetic syndromes in which uveal melanoma may run in families, but this is an exception, not the rule. Typically, if I have it, it is not something that I would be concerned that my family members would get, but I would make sure that they get checked just to be sure that lightning doesn't strike twice.
For our patients and our families, what are the symptoms that our patients might have when they present with this?
In larger melanomas, or ones that are located closer to the critical vision structures of the eye, sometimes it's as simple as some blurry vision. Lines may look wavy, there could be just some distortion in what they're seeing, or just an inability to get good focus. Sometimes people can see bright flashing lights, but the truth is many of the patients that come to my clinic, and to yours as well, Tim, may have no symptoms at all. And this melanoma may have been picked up just on a good routine eye examination by their optometrist or their general ophthalmologist. So sometimes symptoms, oftentimes not.
So it's interesting to me, we have this potentially life-threatening or vision-threatening cancer of the eye. Do we have treatments available for our patients?
That's a good question, and thankfully we do. Depending on the size of the lesion, when it was caught, the location within the eye, so several factors that have to be brought into play, we can do a really good job at stopping this cancer from growing within the eye. The most common way to do this in the eyes that are candidates for this type of treatment is with radiation treatment. These tumors can be treated with radiation, either placed directly on the eye or beamed in from outside of the eye in a very delicate and precise manner. And it can allow for greater than 95% of these cancers to be treated and controlled. In some cases, these cancers are very large to begin with or not good candidates for radiation. And sometimes surgery is required where sometimes the eye is removed. But let's remember, Tim, if we can keep the patient safe and keep them healthy for decades and decades to come, but they may lose their eye in the process. It sounds extreme, but it's well worth the trade-off in some cases.